My friends, during this pandemic, keeping our kids healthy and safe has been my top priority. We were the first province that made the difficult but necessary decision to close schools back in March. This decision put strain on families. But now, looking back, I know we made the right choice. And since then, our most senior health officials, our best experts, the top doctors in Ontario and Canada, including world-class experts at Sick Kids Hospital, have been working around the clock on a plan that will ensure a return to classrooms this fall in the safest way possible. Because when it comes to keeping our kids safe, I won't take any unnecessary risks. And that's why the plan we're announcing today is backed by the latest science and the best health advice available to us. And as Sick Kids has pointed out, we need to weigh the risks of COVID-19 against the harm of school closures. We need to consider the toll it's taking on the physical and mental health and personal development of our kids. We know isolation has been extremely hard on them, not being able to see or play with their friends. We also know our children, especially the younger ones and those with special needs, need the benefit, guidance, and routine of in-class instruction from their teachers. The fact is, we know more about this virus than we did when we first closed our schools, and we know what to do to stop the spread. My friends, we're going to get our kids back to school in a way that looks and feels as much as it used to. 5 days a week, 5 hours of instruction a day, with lunch and breaks in between. We've consulted with Dr. Williams, Dr. Yaffe, Ontario Health, the experts at Sick Kids Hospital, and our local public health experts. Parents, we want you to know that on September the 8th, you can drop your child off at school, knowing that every possible measure is being taken to keep our children safe, knowing that there's a detailed plan to keep our kids safe, a plan developed by the best healthcare experts and top doctors available to us. It's a plan that puts the health and safety of our kids first. It will include important public health measures such as mandatory masks for staff and cloth masks for students from grades 4 to 12, with exceptions for those with medical conditions, cohorting of students to limit contact with other students and staff, expanding testing in our schools, frequent cleaning of the school buses, additional health and safety training for the teachers. We're investing over $300 million, to be exact, $309 million immediately to hire 500 new public health nurses to help in our schools, 900 custodians to enhance cleaning, and the required supplies to keep students and staff safe. We're also ensuring every school follows the provincial guidance on what to do in the event of an outbreak. I'll let Minister Lecce provide more details about our plan in a moment, but I want parents to know this plan was developed by the top health experts in Ontario, and it's a plan that will ensure students get the best education possible. Teachers, we're looking out for you as well. We'll make sure you have the masks, supplies, and protocols you need to teach safely and protect your students. We're taking every step and every precaution to be ready for September. While we're facing an unprecedented situation, we're prepared for anything, armed with the best medical advice available to protect your child at school. With these measures in place, our classrooms will be as safe as we can make them. Because when it comes down to it, our children belong in school. Thank you, and God bless the people of Ontario. Now I'll pass it over to Minister Lecce.
Good afternoon. I want to first off thank members from the Durham Catholic School Board for welcoming us here to Father Leo Austin School. I want to give a shout out to Sam Wisterhoff, the parliamentary assistant, for being a strong leader within education, as likewise to my colleagues from Parliament who are with us, Minister Scott, MPP Coe and Park, the local MPPs, as well as MPP Smith, and all members of our caucus who are present today. In June, the Premier and I made a commitment to parents that we would provide final clarity on how schools will be able to reopen safely, and that we provide choice for parents who are the highest authority when it comes to their children. Today, we are here to unveil a plan to do just that. A plan that was developed by the best medical leaders in this country. Ontario's Chief Medical Officer of Health, the COVID-19 Command Table, the Hospital for Sick Children, parents, students, and many of our education partners. I also want to thank school boards for their immense work they've done over the past few months, including here at Durham Catholic, navigating from very uncharted waters. I now want to lay out our plan to get Ontario students safely back to school this September. First, all publicly funded elementary schools will be reopening province-wide in September 5 days a week. This will also include a safe reopening of the childcare sector to permit operators to reach that full capacity as of September 1. That was a promise the Premier and I have made to moms and dads of this province, and it's a promise we intend to keep. Second, most secondary schools will reopen under an adapted model that limits the size and the interaction of cohorts. As we have previously laid out, groups of 15 students will alternate between attending class in person and online. Secondary schools with lower risk profiles will be able to reopen with a full return to class in person 5 days a week. As we've always said, we will continue to respect the choice and the authority of parents, the choice of whether to enroll their children for in-school instruction, the choice of determining when and if they feel comfortable with their child re-entering school during the year, and the expectation and delivery of live, online, teacher-led synchronous learning for their child when they're not in school. We know that the last few months have not been easy for everyone, but I want to take a moment to acknowledge the impacts this has had, as the Premier noted, on children across this province. We've heard loud and clear from medical and pediatric experts that COVID-19 has had profound mental health impacts on our kids. And now more than ever, reopening schools is crucial to the social emotional development of Ontario students. It's also crucial to allowing parents to return to work and to support Ontario's economic recovery. We cannot and will not allow students to return to school without the necessary support and resources to enable them to confidently return and feel safe from the start. It's why we're investing over $736 million more than last year in public education. Now, this includes $10 million of net new funding for mental health and over $15 million to greater increase access to technology for students. Now, today, I'm proud to announce that our government is further supporting the reopening of schools through a range of targeted rapid response investments totaling over $300 million. New money for masks and personal protective equipment for staff and cloth masks for every student in this province. Over $75 million for cleaning supplies and school custodians. Funding to enable crucial health and safety training for all educators, including those occasional teachers and supply teachers. $30 million for additional staffing based on board's needs on the ground, and over $50 million for the hiring of 500 public health nurses to be embedded in our schools to support surveillance testing and treatment of students. We're also enhancing screening and contact tracing, and for the first time, we are implementing a targeted surveillance testing program for secondary students. We are increasing investment for special education as well, and we're asking boards to ensure students with exceptionalities are in class for the entire week. To support these students, I'm proud to announce an additional investment in funding of $10 million. This will support hiring more EAs, specialized equipment, and whatever else it takes to support the continued learning for those kids. Finally, we're adding another $10 million in funding for mental health supports for students. This is on top of the $10 million that we already announced last month, meaning that our already record investment under this government in mental health is truly unprecedented. We're being cautious. We're taking extra health and safety measures. We are putting in the necessary dollars, and we are supporting parents through this process. Because as the Premier, the Deputy Premier, and I have said all along, we will do whatever it takes to keep your child and our staff safe in this province. And I know it's important for parents to know what the child's school and classroom will look like when they return. And I want to talk to you about a few of those elements. First, on masking. Cloth masks will be required for students in grades 4 to 12, based on public health advice. For our youngest learners, masks will be optional. This consistency will protect all children, parents, and communities, and is directly responsive to the evolving public health data and advice. We're also providing all educators, staff, and students with proper PPE to ensure they can return to work and learn with confidence. Second, as noted, we're providing 500 public health nurses in the schools. In our secondary schools, they will assist with surveillance testing strategy, which will be key. This is on top of our already familiar concepts of cohorting and physical distancing, We will also be supporting public health efforts by continuing to promote our screening protocols so that students and staff do not show up to school if they have any symptoms of COVID-19, even if they are mild. Folks, we've pulled out all the stops for the 2 million students in this province. And let's be clear, our students deserve nothing less. This plan will evolve based on the evolution of COVID-19 and the risk to communities across the province. I just want to end by saying thank you. Thank you to our parents, our educators,